So the day of surgery, when they're in the outpatient surgery area being prepped for surgery, I typically will go to the bedside. If I have to hold their hand while they're getting an IV because they're a little nervous, I do that. I may sing, I may dance, I make jokes to try to distract them while they're getting their IV. They say I'm quite the comedian, honestly. And anyway, so I'll do anything to kind of distract them, then bring their family back, and then that's when I go over what it's going to look like for the entire day. You're giving anesthesia is going to come in. They're going to talk to you. These are going to be your options. You need to make that decision. It is your choice which one you want to do. And I do discuss that in detail with them. And then I will tell them, you can go upstairs, you will walk the same day. They're like, the same day? I said, yeah, I've already kind of told you, you will walk the same day of surgery. But mainly we have to get your pain under control so you can walk. So the patients are like, okay, so I have a plan. But then they worry about what is my family going to do while I'm gone for 4 hours, 3 or 4 hours. So that's when I explain to them, so while you go to surgery, I'm going to take your family up to your room, or I'm going to take them to get breakfast. And then I have a private waiting room on the third floor if their room is not ready for them to be able to take a nap. I get them blankets and pillows and kind of keep them comfortable because I know they are the key to the patient being able to recover because they are the caretaker. So, and then I'll say, once you come into recovery, I will be right in recovery, which typically I'm in the recovery room with them. So they see my face, they have a familiar face to see in the recovery room. When they finish in recovery, I call the patient's family. We'll coming up to the room. I assist with taking the patient to the room. And then once we're in the room, I assist the nurses with their care.